The next question actually goes out to Dr. Insel, but we're so grateful for Dr. Herbert for being here at such short notice and doing a marvelous job in his stead. And the question came from a mom from Florida, and she wrote us the following. Ever since my son was diagnosed 6 years ago, I have been diligent in visiting specialists and seeking treatments to help him improve. I've willingly entered my son's data into several clinical studies done at the hospitals we visit. Because the clinicians tell me this will help find better treatments and answers someday, when will my son be able to benefit from the research we aid? And I would have loved to have asked Dr. Insel, when will the research at the NIH become relevant to help people today? But since he's not here, I can't ask that question. But as a follow-up, considering where research is going and the needs of parents in terms of treatment and support services, what do we need to do to achieve the following goal? In 20 years, every person with autism is gainfully employed, seeking higher education, or pursuing the life of their choosing when they enter adulthood.
We want to know if you're channeling Tom Insel now.
No. I'm trying to get the signal, but it's being overridden by my own signal. So I am frustrated by research myself. I'm a researcher. I actually stopped practicing clinical medicine 2.5 years ago, which I loved doing because by the time I added up all the extra time I had to give to each patient in order to do a proper job, I was making $8 an hour and unable to write my grants or sleep or take care of myself. And that's just not right. It's really complicated, and it's not fair to anybody. It's not just the practitioners. If you do try to spend the 45 minutes or an hour or two in a system where it's not designed for that, it hurts everybody. So then going into research, I think the research system is hamstrung in a lot of ways right now. One of the ways is that there is an obsession based on the idea that this is a genetically determined error in utero development, in finding what that error is and finding the molecular target that we can build out drugs for so that in 20 or 30 or 40 years, we'll have... The problem is that then you find a drug, and then you have to test it, and 95 chances out of 100 it's going to have side effects, and you're back to the drawing boards. And it's even worse if it's a heterogeneous population and there's a whole bunch of different targets for a whole bunch of different subgroups. But this thing goes on, and it gets in the way of looking at the daily realities of people with autism as worthy of being researched and worthy of being addressed by systematic approaches and by systematic data collection of what's actually going on. So I think that there's a terrible disconnect between research and actual practice, and people are, and not only that, the issue of testing treatments is hamstrung by the idea that you have to find out that the treatment works for everybody with whatever autism is, which you define behaviorally, and then if the treatment is a medical treatment, you don't even necessarily have to qualify for the treatment study by their specific medical characteristics, or even if you do, we are lumping at times when we should be watching things go on in a real-time fashion. In the science symposium, the Science That Makes a Difference symposium that follows, we're going to be talking about some approaches to real-time monitoring. Dr. Goodwin is going to give a talk about this, where you actually are gathering data on individuals, high-level, complex data, that you can use right away to help assess what's going on. This is a model which is a very different model, but it's still capable of being rigorous. I think we need to really rethink what it is that we're trying to do. Are we trying to find essential, universal truths about everyone with autism, or are we trying to help? And maybe it doesn't have to be, maybe it's possible to find valuable knowledge without having to establish these abstract truths. There is a role, I think, in the current situation for research that shifts the model. That research can come from treating people effectively and showing that treatment can actually change things about people with autism that people thought were unchangeable. And it can also come from certain kinds of more basic research showing that the assumptions that we've had about how the brain and the body works are maybe not accurate. The Autism Society is sponsoring two projects that I'm working closely with, the Treatment Guided Research Initiative and Autism Solutions. The Treatment Guided Research Initiative, by its name, you can see that the idea is that how do you develop a rigorous research program looking at what is going on in treatment? Evidence-based medicine has to do with testing treatments to prove whether they work or not. There are a lot of treatments which are in use, which are not particularly dangerous, which aren't being studied carefully in the real settings in which they're being used. And we are working to figure out how to do this rigorously. And Autism Solutions, which you'll be hearing more about, is the development of an infrastructure, including database and information resources such as a knowledge base and reference base, to make it possible to collect real-time data over time in people to allow the examination of things which are not currently being supported very well by the funders with the most funding. So I think that there are things that we can do that would really help change things now, and I'm looking forward to having it, once we show that this is possible, hopefully more resources will move into making this happen.